Welcome to the TDCC Community Live webinar. TDCC stands for the Developing Child Center, located in Dubai. Established in 2012. We have been providing personalized support to over 1,000 children. We have 60 dedicated and committed experts, and we work closely with parents and schools to ensure no child is left behind. We think different, we teach different. We empower, not limit children. Labels like autism, dyslexia, and ADHD are not relevant, or perceived as disabilities, difficulties, or disorders that limit children's abilities. We believe that brilliance needs difference. The TDCC services are available in English, French and Arabic. The inclusive educational services nurture and support the developmental and educational needs and help empower each child to reach their full potential. Occupational therapy assists children in performing and achieving important learning and developmental skills they need in life. Psychomotor therapy is a healthcare profession that is based on a holistic view of the person and is involved in the treatment of different disorders. Speech and language therapy assists children who have disorders of speech, language, communication, and swallowing. Psychology provides both educational and clinical services, including counseling and parenting. ABA therapy focuses on improving specific behaviors. It is commonly practiced as a therapeutic intervention for individuals with autism. Specialist learning support. We assist in developing the academic and social development of students who need support in all these areas. And we design and host local and international training and workshops for practitioners, parents, caregivers, and educators. Just like this one today. We have a few rules to follow during the webinar. Please remain muted while the speaker is presenting. Please give your full attention to the presentation. We will be sending you the replay, so you can review it anytime. Please be interactive if the speaker requests your participation. During the question and answer session, we kindly request everyone to type their questions in the chat box and the speaker will address them.
Welcome to the 47th TDCC live webinar on dyslexia and its impact on children's mental health. Ladies and gentlemen, our first speaker is Lina Hajar. Lina is an esteemed expert in educational and skills development with over 20 years of experience, specializing in special education. Holding a diploma with high honors from the American University of Beirut and certified in the Orton-Gillingham approach, she excels in supporting students with diverse learning needs, including dyslexia, ADHD, and autism. Lina is dedicated to inclusive education, individualized learning plans, and multisensory learning strategies. An advocate for inclusion and fluent in English and Arabic, she empowers educators and parents with her knowledge and passion for accessible education. Our second speaker is Joelle Najam. Joelle is an accomplished counseling psychologist with over 10 years of experience, specializing in mental health and well-being within educational settings. With a master's in applied psychology and a diverse background in languages, Joelle brings a unique perspective to counseling children, adolescents, and parents. She is certified in multiple therapeutic approaches. A fluent speaker of Arabic, English, and French, Joelle's expertise encompasses a broad range of interventions aimed at fostering resilience and positive outcomes in both students and families. Everyone, may I present to you our speakers for today, Lina and Joelle.
Thank you,
Hello.
Martine. Thank you for the introduction.
So we're all excited. So while sharing, we'll wait for them to share their screen. Thank you. Now we can see your screen, Lina.
Okay. I'm looking forward to talking with you about dyslexia and its impact on children's mental health. Before I start, I would like to ask you to mention in the chat box if you are a parent or a teacher. Today, we will be discussing dyslexia, some of its early signs, how we can help both academically and emotionally, and at the end, we will answer all your questions. Before going into the definition of dyslexia, I would like to say that in formal assessments, dyslexia is referred to as a specific learning disorder with impairment in reading. However, we will stick with the term dyslexia. There are many definitions for dyslexia, but I chose the one by Dr. Sally Shaywitz, the author of the book Overcoming Dyslexia, because it conveys the message we would like to share with you. Dr. Sally defines dyslexia as an unexpected difficulty in reading in relation to the individual's level of intelligence. She looks at dyslexia as an island of weakness surrounded by a sea of strengths, and I love her metaphor. Let's dig deeper into dyslexia. It is a neurological lifelong disorder. It impacts reading, spelling, working memory, phonological awareness, which is a prerequisite for reading and spelling, and sometimes math. It is the most common learning disorder. 1 in 5 people have dyslexia, and most of the time, dyslexia is comorbid with other conditions such as ADHD, dysgraphia, dyscalculia, anxiety, and other conditions. When we think of the sea of strength, people with dyslexia have many strengths. I'll mention a few. They think out of the box. They are very creative, very good problem solvers, critical thinkers, and might have athletic, artistic, or musical talents. I would like to focus on some of the very early signs of dyslexia, as sometimes these symptoms are overlooked by the school or the parents, and they might say it's too early to diagnose, or eventually they will get it, or let's wait and see. Well, remember, early identification means early intervention. And when you wait to see, the academic gap will be bigger, and so the impact of that on the child's self-esteem. Here is a list of some of the signs. Family history of dyslexia, or reading and spelling difficulties. If one parent has dyslexia, then there is a 50% chance that their child will also have dyslexia. If both parents have dyslexia, the risk is 75% or even higher. Difficulty reciting nursery rhymes. They have difficulty with word retrieval, so sometimes they find it difficult to remember the name of a friend or a teacher or a color. They like listening to stories, however, they show no interest in letters or words. They have trouble remembering sequences like the alphabet, counting, days of the week. They might confuse between directional words like up and down, right and left. They mispronounce long words like remember, helicopter, cucumber. So if you observe some of these signs, discuss with the class teacher and the inclusion specialist and intervene as soon as possible. Now, let me share with you some of the signs of dyslexia during primary school age. Students at this age find it difficulty to blend sounds into words. For example, if they want to read the word hid or best, it will be difficult for them to say b and st. Put them together and read the word best. And the opposite is true. If you give them, let's say, the word drum and you ask them to spell it, it's difficult to think of the individual sounds in the word like d, r, and put them on paper. They have difficulty remembering the order of sounds in words. For example, they might read the word from for form, how for who, tired for tried. They confuse letters with visual similarities such as B and D, P and Q, and less often M, W, and NH. Here, I would like to mention that not every child who reverses B and D or P and Q has dyslexia, because children aged 6 and younger have a normal tendency to reverse letters and numbers. So please don't judge only based on this symptom. They might also have difficulty with letters that have auditory similarities, such as I would like to share with you some examples. So sometimes my student would write bath for bath, has for his, and I will share with you a very specific example. The other day, my student wrote long for lung. And when I was explaining the difference between and ong and focusing on my mouth position, he said, Miss, I can see that your mouth looks different, but I cannot hear the difference. So this is an example of difficulty with auditory discrimination. Difficulty recalling common non-phonetic sight words such as said, where, what. Also difficulty with copying. You might notice that the child would spell the same word in different spellings on the same piece of writing, and their performance might vary from day to another. So in general, their reading errors would be adding a small word, deleting a small word or the S from words, substituting a word with a similar looking one, or transposition, which means they have difficulty with putting the letters in the correct order and sometimes skipping lines. If you observe some of these signs, discuss with the class teacher, inclusion team, and consider a formal assessment. Before discussing how we can help, I would like to share with you a few important points to take into consideration when it comes to children with dyslexia. The potential for maximum reading growth is in the first years of school. That's why early intervention is key. Another point is that children with dyslexia use about 5 times more brain energy for literacy skills, for literacy tasks, more than other children. So that's why sometimes you will see them tired, frustrated, complaining of headaches. So be empathetic, understanding, observe their body language, and give frequent breaks. Another point is that typical students, they need around 5 to 7 exposures to a concept to grasp it. Students with dyslexia require 5 times or more exposures to make connections. That's why your support and patience is needed. How can you as a parent help? Be involved with your child's individualized educational plan. Check what support or services the school will offer. What accommodations and modification will they give your child? And I'm going to clarify the difference between accommodation and modification. So accommodations refer to the how. What changed in the presentation of the material or the response needed by the student or in the environment, like the seating, or maybe in the scheduling and timing, they will do to allow the child with dyslexia access the same content or task. For example, he might be given photocopied notes or given extra time or to give oral responses. Modifications refer to the what, the change in the curriculum or content. For example, to be given easier reading assignment or different spelling words. Talk with the child's teacher at the beginning of every year. Share with her the assessment report. Give her specific examples. How is the child's dyslexia affecting him in the class, and what modifications and accommodations worked with him in the past? Maximize your benefit from the assessment report. Focus on the summary and the recommendations and apply what you can. Make sure to share it with the school. I notice some parents, especially when they are looking for a new school, they choose not to share it. I advise you to share it. Explain to your child his rights and follow up if he is getting the needed accommodations. For example, ask him, did someone read for you the directions? Where did you do the exam? Did you get extra time? If you want to help your child choose the appropriate book for reading, open the book in the middle and ask them to read a page. Take notice of their mistakes, and if they get more than 5 mistakes, then this reading mistakes, it means that the book is difficult for them. Now, many times that school would tell you, read with your child every day. Well, if you are reading and they are just listening, that's really good for the relationship and the connection. But if you are focusing on the reading as a skill, encourage them to follow with their eyes and finger. You might need to help them because this will help them increase their sight words. One more thing I would like to hear clarify the difference between a tutor and a special educator. A tutor helps your child with the curriculum and homework, whereas a special educator helps in the learning gap or missing prerequisite skills, which are sometimes not part of the curriculum. Your child might need both. It's up to you. I just want you to know the difference. Retention or repeating the class as I believe, is not a solution, because by repeating the same class, your child is repeating the same material. In that case, the problem is still there. The emotional impact will be bigger. What would be much more beneficial is intensive corrective research intervention based on the science of reading to help your child learn the key for reading. And later on, I will be sharing a few examples. Now I would like to share with you few practical strategies for reading and for spelling. So I will be showing you a short video for each.
There are many reading rulers in the market. I honestly love this simple one that you can make, and you can use it in many ways. So if your child is starting to read, he knows most or she knows most of the sounds, you can slide it letter by letter. They can try to blend the word and say it. If they don't know the word, maybe you can say it and they can repeat, so you go backward. They repeat and you move on. When they are starting to get better, reading more words, you can start sliding it word by word. This will decrease some of the substitution, deletion, addition mistakes. And when they are getting even better, then you can slide it line by line. When they are better with decoding, maybe if you want, you can stop at the punctuation mark, ask them, what do you picture? Ask them some related questions, because sometimes when a child focuses a lot on the decoding, they might miss part of the comprehension. A daily practice using this reading ruler might be helpful. Try it and let me know.
Now I will share with you a practical strategy for spelling, especially for tricky words.
If your child struggles spelling tricky words, this is a nice activity to do. Choose few words, 3 to 5, not more. I chose these 3 tricky words: said, could, and they. Put them on the fridge. Whenever you are preparing dinner, cooking, ask your child to read the words, to write them in the air while saying the letter name, not the sound, because these words we cannot sound them out. Give them some salt to practice the words with a brush or with their finger, or some sprinkles. Make it fun. Practice frequently. When they are ready, ask them to write them on paper. When they master spelling them on paper, ask them to write them in sentences, to check if they transferred this into writing in context. Whenever they are confident with these words, take them out and put new words and keep reviewing them from time to time. I really hope that this activity will help your child. Let me know in the comments. If your child struggles spelling tricky words.
Okay, now how can class teachers help? By law, individuals with dyslexia are entitled to accommodations, and there are a lot. I will be sharing with you a few of them. So make sure to implement the appropriate accommodations to meet the individual needs of the student with dyslexia. A good reading accommodation, for example, could be to provide pre-exposure to the reading material by allowing the student to take the reading material home and to practice it with parents. This way, you are setting the child for success when it comes to reading in the class. A writing accommodation could be, for example, to answer verbally by recording his or her answers using their iPad. Spelling accommodation could be to grade the writing assessment based on the quality of the content, ignore the spelling mistakes, and to give a spelling list of the week that's applicable for the level of the child. An assessment modification and accommodation, could be to give away the assessment away from distraction and to modify the assessment format, such as fill in the blanks or multiple choice. Now, students with dyslexia benefit a lot from the appropriate visuals, such as personalized writing checklists with pictures, visual for the letters they reverse or the numbers they reverse, individualized list of tricky words. However, if you only put them on the desk, that's not enough. You need to continuously verbal prompt them to use the visuals. Extra time for a child with dyslexia is like a ramp for someone with a wheelchair. It is that important, but it should be accompanied with proper guidance. And the child needs to know exactly what he is going to do during that time. Teach and encourage the student to use sound buttons and syllables. For example, the child wants to read the word rain and he said ran. So tell him to put the sound buttons under. Now let's read R-A-N. What's the word rain? If the child wants to read the word, let's say tomorrow, and he said, oh, this is too long for me to read, invite them or help them to cut it in syllables and say, let's read it one syllable at a time. Tomorrow. So what's the word now? Tomorrow, and so on. Observe their body language, and if you notice that the child is tired, frustrated, give them 2 to 3 minutes break along with a sand timer, because usually students with dyslexia, sometimes they have difficulty with the time concept. The visual that you can see on this slide is really helpful in a class setting to help students understand letter proportion, because many times students with dyslexia, they have illegible or messy handwriting, and they tend to write the letters almost the same size. For example, their N and H or L and I could be the same size. So when you provide them with such a visual along with 4-lined papers, and you do modeling and you practice, you verbal prompt, this is really helpful. Other two visuals that were very helpful for me in a class setting are these. The first one, you can use it to help children connect the graphemes or letter shapes with phonemes or letter sounds with mouse pictures, 3D objects, and this is very helpful to discriminate short vowel sounds. The next one is effective in providing students with a visual for multiple spellings of long vowels, which reduce their spelling struggle. Now, I would like to tell you or share with you how special educators can help. Such a broad topic, I will just highlight a few points due to time limitations. Thorough screening is key to create the right targets. Make sure to screen for all the areas under phonological awareness, as children need a solid phonological awareness base to apply the phonics that they learned. One extremely important skill that's sometimes overlooked in schools is phonemic awareness. As you can see in the picture, phonemic awareness means playing with sounds in words. For example, and this happens orally. Take the word math. Can you replace the first sound with what will the word be? Bath. Take the word math again, replace the middle sound with I. What will the word be? Myth, and so on. This is very helpful for reading and spelling. Other areas to screen, of course, are their knowledge of phonemes, their reading, decoding, sight reading, spelling, and so on. An accurate IEP with smart objectives that target all the areas of weaknesses based on the screening is very important. You can base it on your screening, on the assessment report, on your observations, and of course on teachers and parents' feedback. Building rapport with the child is key. First few sessions, spend time with the child to build a good relationship with them and try to understand what motivates the child, what works for him or her, and include fun. Observe their body language, and usually I do lots of emotional check-in before starting and during intervention. And whenever needed, I would speak with them or give them a short break. Use research-based interventions such as Barton, Orton Gillingham, Linda Mood Seeing Stars, or Linda Mood Bell Lips Program for Phonemic Awareness, or Wilson. These are structured, cumulative, diagnostic, and super helpful. Observing and analyzing the patterns of mistakes of students is extremely important, and it will help you to plan your next lesson or lessons. I really hope that you benefited from the information that I shared with you about the early signs of dyslexia and how to help academically. And now I will give the floor to my colleague Joelle, who will be discussing the emotional impact of dyslexia and how to support.
Thank you so much, Lina, for the valuable information. Today I'm going to be focusing on the emotional, social, and behavioral challenges that a child with dyslexia might experience as a result of his learning difficulties. We will then look at some key strategies that educators and parents can put in place in order to help children overcome those challenges and feel more confident. And we will finally learn how to spot some warning signs that indicate that it's time to get professional help. Now, understanding all this helps parents and educators support children in developing a healthy sense of emotional well-being that will serve them well as they continue their work towards becoming skilled readers and spellers. So what makes dyslexia so discouraging and frustrating? Now, the frustration that children with dyslexia experience often stems from their inability to succeed or to get the results that they aim for in certain domains, particularly in reading and spelling. Now, these are children who are really hardworking. They spend a lot of time studying and trying, only to score much less than what they deserve and much less than others. Students with dyslexia will often make many mistakes that unfortunately may be interpreted by others as careless. Time and again, these students and their parents often hear statements such as, "He's such a bright boy, if only he would try harder." Ironically, no one knows exactly how hard the child with dyslexia is trying. It can also be very discouraging and frustrating to struggle with meeting the expectations of parents and teachers when it comes to reading and writing skills. Now, this discrepancy between expectations and abilities can lead to frustration, stress, and to students feeling chronically inadequate and incompetent. And this is what we're going to explore further in a bit. So what might a child with dyslexia feel or experience? Now, dyslexia can result in a number of emotional, behavioral, and social challenges that a child can experience as a result of difficulties performing tasks that seem to come naturally to others. In 2020, the National Institute for Health Research in the UK found that 40 to 60% of children with dyslexia have comorbid psychological difficulties, including anxiety and low self-esteem. Anxiety is the most prevalent emotional response that children with dyslexia experience. Now, these children become anxious and worried because of their constant confusion in school. The anticipation also of possible failure when asked to read or write can provoke high levels of anxiety and fear. Also, the stress of having to work harder to measure up and to live up to their parents' and teachers' expectations, and the worry about the future for older students who wonder how dyslexia may affect them when they are an adult. Will they be able to pursue their passions? Will they be able to pursue their aspirations? Will they have good job opportunities out there? So all of these uncertainties increase the risks of elevated levels of anxiety. Now, as we all probably know, anxiety usually causes human beings to avoid whatever frightens them. If, for example, I have claustrophobia and I am afraid of enclosed spaces, then I will avoid taking the lift. If, for example, I am afraid of airplanes, then I will avoid traveling. So avoidance is a form of coping mechanism, but it's a maladaptive form of coping because it keeps us stuck where we are and we won't really get to face the stressor and to overcome it. So it's like a safety behavior. So it helps us on the short term, but not on the long term. And the student with dyslexia is no exception. And this is why he will avoid, or at least he will be very hesitant to participate in certain school activities, such as reading out loud, and even avoiding going to school altogether in some extreme cases. And unfortunately, some teachers and parents who are not familiar with the condition might perceive this avoidance behavior as laziness or neglect. Anger is another emotional reaction to dyslexia. At home and at school, children with dyslexia are frequently faced with tasks that they find challenging. They also witness their siblings and their classmates making progresses in areas where they are stuck, mainly reading and writing. So this ongoing frustration builds up and builds up until it spills over as anger. And it's helpful to remember that anger is just one of the ways that children mask their anxiety. Now, when it comes to anger, you might observe that your child directs his anger inwards, which means he directs it towards himself. He holds it within himself. So he starts blaming himself and becoming very self-critical. And this is what we call internalized anger. Or he might externalize his anger, which means he directs it towards others. And this is where we observe him, for example, screaming or pushing others. Children with dyslexia often suffer from low self-esteem. So self-esteem refers to how we view, how we perceive ourselves. So it's the judgment that we give ourselves. So someone, for example, who has high self-esteem may perceive themselves as competent, lovable. By contrast, someone with low self-esteem will view themselves as incompetent and unlovable. Now, how is self-esteem linked to dyslexia? Succeeding in school usually helps children develop positive feelings about themselves. So they feel competent, smart, and powerful. However, when they experience persistent difficulties and challenges, they begin to feel that they are inferior to others and that their efforts make very little differences. So instead of feeling powerful and competent, they will feel powerless and incompetent. So lack of motivation, is another challenge for children with dyslexia. People generally tend to steer clear from things that they're not good at. We are motivated by the things that we do well, and we are discouraged by the things that we don't. So the persistent difficulties, the challenges, the mistakes, the negative feedback at times, all this results in a student not wanting to participate, feeling withdrawn, and in some extreme cases, not wanting to learn anything at all. And this is what the renowned American psychologist Martin Seligman described as learned helplessness, meaning that when children realize that they're not meeting the level of success, despite their consistent and repetitive efforts, they might unfortunately give up, thinking that they have no control and that whatever they're doing just isn't working out. While some children with dyslexia may experience symptoms of depression, such as sadness or low energy, it is not accurate to say that all children with dyslexia are depressed. They are, however, at higher risk for developing emotional and psychological difficulties compared to their peers who do not have a dyslexia. Now, because of his poor self-image resulting from his academic difficulties, a child with dyslexia might feel uncomfortable in social situations, Also, his difficulty in finding the right words or remembering the sequence of an event might create awkward situations or conversations. As a result of his learning difficulty, a child with dyslexia might at times be teased, mocked by others, and maybe bullied, which further, of course, develops problems in social relationships. Now, dyslexia may affect the family in a variety of ways. One of the most obvious is sibling rivalry. A typically achieving child might feel jealous of the child with dyslexia who seems to receive the majority of his parents' attention. A child with dyslexia might feel sometimes invalidated or misunderstood by his parents, who also might feel overwhelmed, sometimes guilty, not knowing what to do. And all of this can create immense pressure affecting the family dynamics. Research has shown that some parents, when they receive the diagnosis of dyslexia or any other learning disorder, they go through a form of bereavement or mourning. They mourn the loss of their ideal or perfect child, the one who would become a doctor, a lawyer, or an engineer. So, how can school and educators help? So first and foremost, we need to increase awareness of learning differences and neurodiversity across settings, because the more the community knows, the more understanding and supportive they will be. It is vital to promote a culture of acceptance, of tolerance, a culture that embraces neurodiversity, which refers to the fact that people experience and interact with the world around them in many different ways. And there's no one right way of thinking, learning, and behaving. And that it's extremely important to honor the differences and the uniqueness that each child brings. So every school, every classroom, every educator should be equipped and knowledgeable about dyslexia, and mainly should know how to serve and how to support students who are diagnosed with it. Now, talking about empathy and patience, so we have to understand that when we're dealing with a student who is struggling with dyslexia or with reading, we need to be patient. We must remain patient and accept that they will learn, they are going to learn, but at their own pace. There will be days when they won't read a single word, and other days when they might be willing to try their best. So we need to praise them on those good days and show empathy and understanding on the more difficult days. So you can say something like, for example, I can imagine how difficult this must be, and I understand your frustration, but I want you to know that I'm here for you and we can do this together. Now, one of the most valuable things that educators can do is to highlight areas of strength, and this is a big one. Really, this is the most important thing, actually. So instead of focusing solely on the difficulties and shortcomings, why don't we try to pinpoint and highlight areas of strength? If a child constantly receives negative feedback or is constantly reminded of his limitations, then his self-confidence and his motivation are going to be massively affected. This is why it's very important to highlight what the student is good at and celebrate his success. And as Lina mentioned earlier, children with dyslexia are usually, for example, very creative. They have excellent problem-solving skills. They can see the bigger picture. So all these are areas of strength that we should really put in advance. One way that students with dyslexia can develop their own self-image is also by helping others. So if a student, let's say with dyslexia, is good in science, this could be a good opportunity to provide peer support to another student. Not only will this boost pro-social behavior in your classroom, but it will also show him that there is value in what they bring to the world. Educators are also kindly requested to emphasize efforts over results. Now, as educators, it's our responsibility to provide positive and encouraging classrooms. It is very important to focus on the learning process rather than the end result. This mindset helps reduce anxiety and increase motivation. Help students with dyslexia develop a growth mindset. So explain to them that mistakes are part of the learning process and help them see challenges as opportunities for growth and skills development. This will help them cope with disappointment along the way. Help students with dyslexia set realistic goals for themselves. We all want our student to succeed and get good grades, and this is fine. This is perfectly fine. However, we should be very careful about helping them set realistic goals and also having the right expectations of them, expectations that they are capable of meeting. If, for example, we ask a student to read one full paragraph or maybe one full page without making any reading mistakes, he probably won't be able to do it. And this will only set him for disappointment and frustration. So by helping a student set and achieve attainable goals, teachers and educators can change the cycle of discouragement and frustration. Now, how can we help our children as parents? Now, the first step towards helping your children is to acknowledge and to accept that they have difficulties. I totally understand that it's not easy, but it's helpful to remember that you and your child are not alone in this, and that there are specialists and people who can support you on this journey. Accepting dyslexia is crucial because denying its existence will only delay the treatment and the support that we can provide them. Learn as much as you can about dyslexia. Take the time to learn about the therapies that are available, about the programs, about the characteristic of dyslexia, about the learning strategies that will be most suitable for your child. The more knowledgeable you are, the less anxious and confused you will be, and the better support you can offer to your child. It's also extremely important, of course, to talk about dyslexia with your child. So help him understand what dyslexia is and what it's not by providing a clear and simple explanation. For example, you can say something like, well, you struggle with reading sometimes. It seems that the words just don't make sense to you. This difficulty is called dyslexia. By doing so, you can empower your child to understand how his brain works and also what works best for him as a learner. It can also help combat any misconception that he may start to have. For example, that he's not smart or that he is lazy. When you talk to your child about dyslexia, it's extremely important that you clarify that their struggles have nothing to do with intelligence or other cognitive abilities. They just learn in a different way and at a different pace. Now listen to your child and validate their emotion. As parents, it's very important that you foster an environment where your child feels safe to express himself and ask for help. Always, always, always encourage open communication and listen to your child's concerns and fears, and of course, try to reassure him. Check in with them regularly. Ask them how they're feeling, what's difficult for them, what's particularly challenging. Validate their emotion. Validation doesn't mean that I accept the behavior, but it means that as a parent, I try to understand where this behavior is coming from. So I'll give you an example. Let's say your child comes home from school after a long, hard day. And we all know, as Lena said earlier, that children with dyslexia, they have to make more efforts than their typical achieving peers. So this will create fatigue. They will become very tired and so they will have fatigue. So while talking to you, he might snap, for example, at you. So instead of saying you are disrespectful or you are rude, what can we say? We can say, I can see that you're angry, and I understand your frustration. However, talking to me like that isn't really appropriate. So what did we do here? What we did here is that we asked him to modify the behavior without judging him as a person. We separated the behavior from the person. Now try to use the we language where possible so that the child understands that you're with him and not against him. For example, instead of saying, what can you do to have a better grade? We can say, what can we do to make things easier for you? Also, try to use the word yet when possible, which sends an encouraging message. So if your child, for example, says, I cannot read properly, you can tell him, I cannot yet read properly. If he says, I don't have good grades in reading, you can tell him, you don't have yet good grades in reading, which implies that it's coming and that you're going to progress and get there. So this is much more encouraging. Unconditional love, it's very important that our children know that their success is not a condition to our love. We love them whether they're top of the class or whether they're good enough students. So you can say something like, I love you no matter what, and I am so proud of how hard you tried. Model a positive attitude and teach your child about growth mindset. Children observe how we react to things and then they model our behavior. They are like sponges and they absorb our reactions, our behaviors, our attitude. So it's very, very important that they see you reacting positively to your own shortcomings so that they can pick on that. So let's say that, for example, you're baking a cake, but then the cake got burned. So instead of blaming yourself in front of your child and using discouraging words, you can say something like, well, at least I tried, and next time I know what ingredients I should use and how much time I should let the cake sit in the oven. This is teaching them that mistakes are part of the learning process and that they help me develop and improve my skills. Help your children combat negative self-talk and encourage self-compassion. When things don't go right in our lives, when we are worried, anxious, or stressed out, we all have sometimes these negative automatic self-talks that just pop up and discourage us. This is why it's very important to bring awareness to your child about these thoughts and to teach him how to identify them and replace them with a more moderate way of thinking. If, for instance, your child starts saying something like, I'm a failure, please do not ignore it, do not overlook it. So you could encourage him to adopt a more moderate way of thinking and say instead, reading is not an area of strength for me, but with practice and determination, I will improve. Encourage self-compassion. So some kids are very harsh on themselves. They're very critical, they're self-critical. So it's very important to teach them to be nice and compassionate, not just to other people, but to themselves. So teach them to forgive themselves, to be gentle with themselves, and to remember that no one is perfect. Self-compassion is key to mental health. Help them recognize their strength and invest in their interests. Very important to explain to our children that dyslexia does not define them. It does not define who they are. They are much more than that. So if reading, for example, is not a key strength, your child can still excel in other domains. You could tell them, for example, to encourage them, wow, you showed excellent teamwork in the football game the other night, and that was a great goal that you scored. If your child likes art, you can enroll them in an art class. If they like sports, try signing them up for a lesson or a team. Emphasize efforts over results and have them set realistic goal. I think this is something that we mentioned earlier with the teachers, so the same applies for parents. Help them adopt healthy lifestyles and habits. So it's important that you ensure that your child gets enough sleep, for example, because as we know, sleep is very important for emotional regulation. It's very important also, it will help us focus better at school. It will help us memorize better. So encourage them to eat healthy, to exercise. Exercise is extremely, extremely important because our body releases the endorphins when we exercise regularly. Teach them coping strategies. So teach your child strategies to manage frustration and stress. One thing very important, we don't want them, we cannot stop them from feeling angry or from feeling stressed out or from feeling anxious, but we can teach them healthier coping mechanism techniques, such as, for example, deep breathing, mindfulness, progressive muscle relaxation techniques, or exercising. If, by the way, you need any of these techniques, like the breathing techniques, the progressive muscle relaxation, or even visualization techniques, so please just send us a message, and then we can send you by email all of them. So we saw earlier what we should be doing, and now we're going to see what we should be avoiding. So Very important to avoid comparison. So please, please, at all costs, refrain from comparing your child to their siblings, to their cousins, to the neighbors. They are already aware that they are behind in certain skills. Comparing them to others can be very detrimental to their self-esteem and adds to their pressure. Instead, always compare your child to how he was and to the progress that he has made. Avoid shaming and punishment. We have to mind our words when we talk to our children. We have to be very careful about the choice of words that we use. As we say, the way we talk to our children becomes their inner voice. So we have to refrain from shaming them, from using words such as slow, weak, lazy, because the more they hear them, the more they believe them. So instead, replace them with uplifting and encouraging words. Also, definitely do not punish or blame your child for something that he is not responsible for. He is not responsible for his dyslexia. Avoid saying yes, but, so I'll explain. Your son, let's say he's happy, he's coming home from school and he's so proud of himself because he was able to read a small paragraph, very small paragraph, without any mistakes. So instead of saying, yes, that's very good, but you should have read a bigger paragraph, please stick to the yes and just congratulate him, because if you say but, it is discouraging for him. Another also language to avoid is saying if, then. For example, if you do well on your reading test, then I will buy you that t-shirt that you wanted. So this is conditional appreciation. It's a form of emotional blackmail, and it is asking for something in return. Instead, what can you say? Once you finish your test, your reading test, and I'm so sure you're going to do well, we are going to get you the gift. So anyway, I'm going to get you the gift, whether you do well or whether you don't do very well. What matters to me is the efforts and that you try. So as you know, there are so many people out there who have dyslexia and who are not only successful, but famous too. So it could be really uplifting for your child to know that they share a trait with someone they admire, a role model. It could be anyone, like it could be an actor, an influencer, an author, anyone who has dyslexia but found success, and anyone who they admire. So. Now, when to get professional help. Now, if you notice a sudden change in your child's behavior, mood, sleep patterns, appetite, or a decline in his academic performance, and if this change lasts for a long period of time and is interfering with his ability to function properly, do not hesitate to consult a mental health professional. They can provide you with valuable support and guidance. Now, a sudden change in behavior could be anything like social withdrawal, isolation, and aggressive behavior, maybe like kicking, pushing, punching. A sudden change in mood could be anything like sadness, maybe throughout the day, low energy, easily frustrated. Same with sleep patterns, for example, there will be change in sleep patterns. So you might see that your child suddenly has insomnia or he's having nightmares. What else? And the appetite patterns. So your child is not eating anymore like he used to, or on the contrary, he's eating too much, and this is emotional eating. And of course, decline in academic performance. We don't mean just decline in reading and writing, but general decline in all subjects. Now, all of these signs are indicators of intense emotional distress that need to be addressed. Finally, I just want to take a moment to introduce you to cognitive behavioral therapy that we usually use to help children who are struggling with anxiety and low self-esteem. So research has shown that cognitive behavioral therapy, also known as CBT, is one of the most effective forms of therapy for children suffering from anxiety, panic attacks, low mood, and anger issues. CBT is a short-term treatment approach, and it's typically offered once a week for a period of about 4 months. Now, during the session, the child works with his therapist to identify maladaptive pattern of thinking, which we call automatic thoughts, challenge them, and then learns how to come up with a more moderate way of thinking that will help him feel better about himself and improve his emotional well-being. Thank you very much.
Thank you, Joel, and thank you, Lina. Thank you for the beautiful presentation, very interesting presentation for today. Now we move on to the question and answer part. If we can, may we invite all the participants who have questions to please write them on the chat box. Thank you. And let me check if we have some question here. We have one question from Jamila. And she said, for dyslexic children, can the child be dyslexic only in one language? So who would like to answer that? Thank you.
Hi, Jamila. First of all, it's a very interesting question. I hope you benefited from the presentation. Well, usually if it affects a language, it affects the other languages. However, also it depends on the language itself. For example, Spanish language is usually the kind of one of the easiest languages for students because it's like phonetic. So it depends on the language itself, like how complex it is, but usually it affects all languages. But as I said, it depends also on the complexity of the language. And here you might need the help of an educational psychologist or clinical psychologist. When they do the formal diagnosis and the full assessment, they will be able to help you, particularly in that aspect.
Thank you, Lina. Thank you. Next
welcome.
question from Ashmita. The question is, the session was very interesting. Thank you. With regard to dyslexia, how can parents make them to involve in activities in home practice?
So if I
You mean like educational activity? Yeah. Yeah, okay. It depends on what's the need. For example, let's say the child has difficulty in blending, an activity that I like, I just want to show, like, to tell the child. So regarding the educational activities, it depends on the need. I will just give an example. Let's say the child has lots of difficulty with blending, which is many times the case when they are 5 or 6 years with oral blending. I'll just do it like this to show. So for example, you can say, I'm going to say sounds. Here is the beginning sound. Here is the middle sound. Here is the end sound. So repeat with me. K, a, t. Sometimes the child even cannot blend them orally. They will tell you, at, dog, anything. Okay, let's try together. Can you continue? Because this way is like concrete. You can even do it in the car. So phonological of awareness, for example, you can do it like you give just a word, asked, give me the word. They will say fast. So this way you are practicing oral blending. You can tell them, for example, let's say the word is seat. Can you tell me seat without s? They will say eat. Okay. Can you remove change into b? What will the word be from the word seat? It will be beat. These kind of playing with sounds, remove a sound, add a sound, are very helpful, but I cannot give you in general. I just gave a specific. So each depends on the need. Okay.
All right. Thank you, Lina. Next one is from Rima. Do you recommend to exempt students with dyslexia from learning a new language and to stick with their mother tongue?
Yes. Yes, definitely.
All right. Next one, where in Dubai the teachers can get training in working with dyslexic children. This is from...
You can contact centers, or you can take courses online, like I took for the Orton Gillingham to be certified. If you want something specific, reach out to me by email, and I will try to help you.
Thank you, Lina. We will be sharing the emails of our speakers today later.
Perfect.
And from Ridan,
yes.
Thank you very much. Yes, thank you also. Just checking to see if recording of this presentation will be shared. Yes, we will be sending you all registered participants. So we have your emails with us, so we can share it with you. We will send it. Another question from Abir. My child was assessed by a children educational maybe a child educational psychologist at the age of 6 and showed no signs of learning disabilities. He is almost 8 now, but we feel that there are many signs of dyslexia or other learning difficulties. Should we do another assessment?
Yes, there are two things. Either you do another two formal assessment, or if you want, you can do a screening, and then the person who does the screening will tell you if he needs another formal assessment or not, or maybe do intervention for a couple of months. And then if he progressed or she progressed quickly, it means it's a learning gap. If the progress is like a little bit slow, maybe then it's worth repeating the formal assessment to check what learning disability he or she might have.
Mylene, there's a question to which I would like also to answer, please. So it's, I guess, Ricardo, how can we help the student if the parent is in denial? That's very important. I believe the teacher here is asking the question. So usually there's an educational team. So this is what happens in school. So there's a whole educational team who ask the parents to come for a meeting, and then they discuss with the parents, the strength. So always try to focus on the strength to encourage the parents, and then to show him that your child, because they want to hear something positive. This is very important. Don't just talk about the limitations. So focus on the strength, that he has strength, but then these difficulties are really preventing him to progress, and they are affecting his self-esteem. Very important to emphasize on the self-esteem, and also to reassure parents that the aim for you is to help the child and not to create a problem. So we don't want to add to the problem. On the contrary, we want to help him succeed and help him progress, because this will also affect his self-esteem and his motivation.
Thank you, Jo.
Marlene, I can see here a question that says, how to diagnose a dyslexia child in the school?
We don't do
actually,
diagnosis,
I worked
screening.
years in a school. I never diagnosed a child with dyslexia or other. This needs the expertise of a clinical psychologist or educational psychologist. At school, you can only do screening and check what are the learning or missing prerequisite skills to put an IEP and work on that. But we cannot diagnose in a school setting.
And I can also add, also because I work in a school as well. So at school, as Dina said, we only do screening and direct observation of behavior. It's very important, direct observation in the classroom, meeting with parents also. So you gather all the information, right? But at the end of the day, the complete diagnosis is done either by a speech therapist or by an educational therapist.
And also I can see how to deal with a child who is embarrassed about his dyslexia and is very reluctant to seek help at school. First of all, he needs, as like Joelle mentioned, he needs to feel successful in anything. So maybe if he cannot read, let's say at year 3 level, but maybe he can read a story at year 1 level. Give him something that you feel he can be successful in, and let him get some help maybe from the learning support assistant or the inclusion team, and build up gradually. But what's important is that he needs to be successful at something at his reading or ability level.
And I'll add also, that's why I think that it's very, very important to promote a culture, where they accept diversity. So this is why at the beginning of the academic year, so there should be some workshops, in the classrooms, where we talk about differences, where we talk about neurodiversity, so that children, so in order to foster a culture of tolerance and acceptance, so that no one will feel embarrassed.
Any more question, Lina, that you can read from your side?
There is someone asking if I can share a screening tool. Honestly, I cannot because I don't use one screening tool. I use a dynamic approach. So I might use a tool for phonemes, a tool for visual discrimination, a tool for auditory discrimination. So I use a variety of tools. It's not like one tool. And anyway, it's like an informal assessment at the end. So honestly, I cannot like share one specific tool, unfortunately.
Yeah, okay. So I think we have addressed all the questions. Let me go over. Oh, here, this one. Any checklist available to identify a child, whether dyslexic or slow learner? Someone asked that.
Where is the
Any
question?
checklist? She's asking for a checklist.
Yeah. Yeah, okay. I really don't have a checklist. Usually I screen all the areas under phonological awareness. As I said before, auditory discrimination, visual discrimination, reading, decoding, sight reading, all the phonemes.
And yeah, and I can add also, like usually, so to identify and to know if a child is a slow learner, so we do a neuropsychological assessment.
Yeah,
So this is
formal.
a formal
Yes,
assessment. So this is the only way where you can really identify if a child is a slow learner. So because they will assess the executive functions of the brain, such as attention, memory, comprehension, logical thinking, and so forth.
All right, that's it. Thank you so much, Lina. Thank you so much, Joel. And thank you everyone for joining us today. I think we have already answered all the questions. They're all interesting. And everyone, thank you so much for all the compliments. Thank you. Someone said it's an excellent presentation, an excellent webinar. Thank you so much. And
thank
yes,
you for all the attendees, and thank you for you, Marilyn.
Thank you.
Thank you. And everyone, I'd like to share my screen again for some announcement from TDCC. And if you have any questions about the topic, please send us via email. Thank you.
We would like to take this chance to share with you some updates from TDCC.
Our spring camps are now open for registration. Enroll your child into the Spring Phonics Boot Camp and enjoy the 2-week intensive journey. Watch them bloom with confidence and skills. Designed for children aged 5 to 11, this boot camp is the ultimate gateway to enhance your child's literacy skills while fostering friendships in our intimate group sessions. Spots are limited. Enroll now and build reading fluency and accuracy, spelling and writing phonics skills. TDCC Spring Camp in the Inclusive Education Services is now open for registration. Join us for 2 exciting weeks of nature explorations at our spring camp, featuring themes that celebrate the spirit of spring. Activities are developed and facilitated by a team of specialist educators, speech therapists, and occupational therapists to enrich and support the development of children. Enroll your child now and explore music and movement, sensory play, arts and crafts, literacy and numeracy, storytelling, social skills, cooking, and role play. Caregiver training. This program focuses on developing knowledge, skills, and values necessary to provide quality care for children of determination. The training will cover topics such as the basic needs of the child, communication strategies, understanding behavior and sensory needs, social and play skills, and fostering independence and home routines. This is facilitated by experienced and committed educators in the Inclusive Education Services led by Amina Shazib, psychologist and head of Inclusive Education Services.
Our summer camp is now open for registration. Join us on a summer adventure where young minds explore, play, and create through hands-on science, sunny beach fun, and artistic musical expression. Designed for children aged 3 to 13 and can enjoy 6 weeks of fun to discover, learn, and play on this transformative Summer Camp 2024. Register your child now.
Secure a spot in our Inclusive Education Services. This is open for children aged 2 to 13 years old. This is a unique program integrating both educational learning and therapeutic strategies designed for children with learning difficulties. We provide early intervention programs, preschool intervention, life skills, and school readiness program.
The Hanen program, It Takes Two to Talk, is a Canadian evidence-based training designed for parents. This program helps many parents improve their communication skills and strategies to help their young ones. Designing Your Life Exploration is a groundbreaking program that empowers the youth to increase self-confidence, take control of their future, and explore life and career options aligned with their passions. It's a 2-hour jumpstart into new perspectives. Bond and Build Social Club. Designed as a lively, interactive group experience, this club gathers kids within the same age and developmental stages. This program focuses in amplifying skills in key areas such as conversation and social connection, executive functioning, friendship and relationship development, perspective taking, social self-regulation, and social thinking vocabulary. Inspire to Impact Club, designed for children aged 7 years and up, and to be attended with a parent. Session 1 focuses on eco-friendly gardening through compact microcontroller using the 3 Ps: people, planet, and prosperity. It's a gateway to optimize home gardens, conserve water, and embrace sustainable practices. Eating therapy. This therapy session helps children who are struggling to eat. Our therapists provide evidence-based approaches on how to make mealtime enjoyable that would eventually end mealtime struggle. Spot therapy combines speech-language and occupational therapy for children, offering enhanced attention, improved social skills, integrated language, and communication development to children, and consistent support for parents and caregivers. Sensory integration therapy. This is an evidence-based approach that benefits children beyond autism. Our therapists create a sensory-rich environment using specialized equipment. This therapy focuses on developing a strong sensory system, which is crucial for motor skills, executive functions, and behavior. Thematis listening therapy. This is a transformative auditory training therapy available for children and young adults. This therapy listening method has been proven effective in enhancing attention skills and communication abilities. Neurofeedback therapy. At TDCC, we specialize in neurofeedback therapy for children and young adults. It promotes mental well-being in young individuals with anxiety, depression, ADHD, and many more. Visual perception therapy. In this therapy, children improve their visual processing skills through specialized activities and exercises. It enhances visual discrimination, tracking, and spatial awareness, leading to improved academic performance and coordination. This is tailored to each child's needs. It promotes independence and success in daily life. Spider cage therapy. This is a transformative intervention for children designed to address motor challenges and sensory integration difficulties. This therapy optimizes motor skills, coordination, balance, and sensory processing to foster the overall development of children. Our handwriting program is available in Arabic, English, and French. Children who are struggling to write legibly can benefit from this program. TDCC is home to highly skilled dyslexia and literacy specialists who conduct personalized assessments to identify specific challenges individuals face with reading, writing, and spelling. We use evidence-based strategies and interventions, and develop tailored plans to improve phonological awareness, decoding skills, and spelling abilities. Reading Dogs at TDCC. Happening once in a month, on a Sunday at TDCC premises. This program brings about excitement, fun, and love of reading, and lots of activities with the reading dogs and children. As this is free of charge, registration is on a first-come, first-served basis, as we only have a very limited space. The program aims to accommodate interested children to attend at least one of the sessions to give them this wonderful experience. FLY. Flourishing and Leadership for the Youth. This is a resilience-based program designed and delivered by a social behavior counseling expert, Kipa Shrestha for children aged 7-12 years old. The FLY children will learn positive self-talk, mindfulness practices, and gratitude practices. By the end of the 5-week workshop, they will have developed the necessary skills and character traits to face challenges with resilience and lead a flourishing life. Educational psychology. Our expert psychologists provide educational assessments and schools observations using evidence-based tools and strategies to help parents and schools make informed decisions about the students' education. Counseling services. At TDCC, our psychologists incorporate proven cognitive-based therapy and practical strategies and solutions to support children, adolescents, and their families to meet family objectives. Parenting services. The parenting services focus on specific challenges related to child development, behavior management, and communication. It empowers parents and caregivers with the tools in helping children achieve a happy, healthy, and well-adjusted life. If interested in any of these programs, please contact us. Have a screenshot with our contact details. You can also share this to your friends and to anyone who needs support. For updates of the next webinar, training, and services, please scan these QR codes. Follow us on social media. Visit our website for more information and booking of appointments. Thank you once again.